Thoracic and lumbar muscle energy techniques use neck and torso positioning to mobilize the thoracic and lumbar vertebra. We will review 3 different muscle energy examples. Let's start with upper thoracic somatic dysfunction. Here, our example is T2 to 4, neutral, side bend right, rotated left. Physicians, your treatment should be focused on T3, the middle segment of this group dysfunction. Patient is seated, and the physician should be standing behind the patient. The barrier at T3 is engaged by a long lever method. In other words, the barrier is engaged by side bending the cervical spine left and rotating right. Your monitoring hand should be looking for the restrictive barrier until the resistance is felt. Once the barrier is engaged, ask your patient to rotate left while you resist. Hold for 3 to 5 seconds to produce a counter force to the patient's muscle effort. Ask the patient to stop the muscle effort, pause for a little, and move the vertebra further in the direction of the restrictive barrier. Start isometric contraction again, then ask the patient to stop. Engage the next barrier to start another isometric contraction. Stop contraction, then move to the next barrier. Notice that this treatment had 4 contractions. Muscle energy requires 3, 4, or more contractions until you are able to eliminate restrictive barrier. You finish the treatment with a final stretch. Once finished, please reassess. For our second example, we're going to review treating a type 2 somatic dysfunction. In this case, the diagnosis is T8 flexed, rotated side bend right. With your patient seated with both arms crossed in front of the chest or in a genie position, physician stands behind the patient and contacts the arms and the trunk anteriorly to engage the sagittal barrier by extending the thoracic spine at T8. Be sure to avoid overextending or underextending the patient. Once the sagittal barrier is engaged, rotate the trunk towards the left and side bend the trunk to the left to engage the side bending and the rotation barrier. In this case, Dr. Williams is standing on the left side of the patient, and this allows easier trunk rotation to the left. Start isometric contraction for 3 to 5 seconds. Stop contraction and engage the next barrier. Start isometric contraction again. Stop contraction and engage the next barrier. Finish with a final stretch and reassess. Energy has a similar setup as middle lower thoracic region. Patient is seated in genie position, and physician stands behind the patient to contact the patient's arms to move the trunk to engage the barrier at L4. Engage the barrier by side bending left and rotating right, so L4 engages the barrier. Start isometric contraction. After 3 to 5 seconds, you engage the second barrier. Repeat the isometric contraction here and engage the third barrier. After the last contraction, finish the treatment with a final stretch. You should always reassess after the treatment.